You can see it pictured on the upper right. It comes in traditional syringes as well as little ampules that you can put in your delivery gun. But really, this lives somewhere between a traditional body composite and a runnier flowable composite. It has the benefits of flowable composite in the sense that it adapts and wets well. So it adapts to the substrate very well and void-free. But at the same time, it's got enough viscosity or stackability that it stays put, stays where you put it, and doesn't creep very much. This is largely related to the filler content, and it is 80% filled by weight and nearly 70% by volume. That approaches some very good body composites. The entire GrandioSO line utilizes a nanoparticle size technology, and so you'll see that consistent. Where can we use it? Essentially across all cavities for all classes. Small load-bearing occlusal cavities are okay. Extended pit and fissure sealing. The class 5, whether they're carious lesions or the NCCLs, the non-carious cervical lesions, the term that's replaced essentially what we used to call quote-unquote abfractions. We can use it in our lining techniques underneath for folks that like to place a capping layer of composite. We can use it as a matrix resin for splinted fibers and splinting teeth together. Essentially, any kind of repair that we want, if we want to retread an existing composite and clean it up, chips on ceramic restorations, it really becomes kind of the duct tape of composites. And where I use it quite a bit is this. We see more and more of this in our patient population. Folks that have worn away their enamel through some parafunction, and on posterior teeth, eventually dentin's exposed. And now not only is that dentin susceptible to mechanical wear, it's susceptible to acid. So you'll start to get erosion on that dentin beyond the contact point. So you'll see these deep pits, and depending on whether it's systemic acid, dietary acid, whatever it might be, you'll see those areas getting deeper and deeper. And so this is a great way to restore those because we get very good adaptation and have very good occlusal characteristics. And of course, what we're here to talk about today, how I use these products for my attachment application. So the entire GrandioSO line, and this is kind of Voco's operating model, is they try to make composites that, as much as possible, act like tooth structures. So let's look at some of these characteristics. If we look at modulus of elasticity, you'll see where GrandioSO Heavy Flow falls in. The top line is dentin, the colored line. So this is as close as we can get to dentin. You can see some of the competitors where the flowables fall and how GrandioSO Flow, Heavy Flow, compares to body composites that should have good characteristics. Flexural strength. You can see that not only does it beat a lot of the flowable composites, it actually beats a lot of the body composites. Compressive strength. Now not only is dentin outlined here, but also enamel compressive strength. The compressive strength we get with GrandioSO Heavy Flow rivals that of a lot of macrofilled buildup materials or core materials. When we look at solubility, it's one of two products that has virtually undetectable solubility. And when you look at solubility and surface hardness, these are two things that relate a lot to the kind of polish and finish that you can get on a restoration, as well as how that polish or finish is maintained. If the restoration washes out, if it pits, its susceptibility to pick up stain, how nice it looks down the line. An important aspect is radiopacity. We certainly want our composites to show up on recall x-rays. We know what kind of material we use, but we have a flux in patients. They leave practices and go to new practices. It's very hard as a practitioner to diagnose a radiolucent or a dark line underneath the composite. Is it decay? Is it a base layer of composite? It's important for these restorative materials to show up as much as possible on radiographic recall. And the big thing, shrinkage. You know, that was a hot topic a few years ago. It's still very important. And we know that as a composite becomes flowable, we have to reduce filler content. And so the more resin there is, the more likely it is to shrink. We know by definition flowable composites will shrink more than body composites. But you can see as a flowable composite, it's dropping below 3%.